I have a little demonstration of the serial puncture microdroplet technique. This is one of my gracious patients that presented to my office 2 weeks before the marriage of her daughter. And she said, "Doc, just do what you can to make me look my best." I want to just point out some anatomical areas on the face that I'm going to be referring to during the rest of the talk. So these are the lower eyelid bags, and underneath the eyelid bags, in just about everybody, is what I refer to as an eyelid groove. These are not going to be corrected in her because of her wedding 2 weeks later, and eyelids can be a little puffy and bruised. The crease that forms with aging from the corner of the nose down to the corner of the mouth is called the nasolabial fold. The fold that tends to form, in her it's worse on her left side or the right side of the screen. The fold that forms from the corner of the mouth down, I refer to that as a marionette groove or a marionette fold. And obviously these are the patient's lips. So we decided that the best way to proceed would be to fill in the nasolabial folds, fill in the marionette grooves, and make her lips one size bigger. The areas are marked with some iodine paint, which serves to sterilize the area, and it serves to mark the site for injection. And the glistening substance that you see in the area is my topical anesthetic that provides profound anesthesia after about 15 minutes of application. So I'll recline the patient slightly. This is a glass syringe. The clear liquid in the syringe is liquid injectable silicone. I'm starting on the marionette groove on the right side, and it takes me about 12 to 15 punctures from the bottom of the groove to the corner of the mouth to complete the right side. I'll then have the patient hold some firm pressure. I'll go to the other side and march from the bottom of the groove up to the top of the groove with about 12 to 15 punctures, depositing a very small amount of silicone from the bottom of the groove to the top. Then as she's holding pressure there, I'll move over to the nasolabial fold on the right side, and again, 12 to 15 punctures, depositing a very small amount of product. I move my way up the fold to the top, have the patient hold pressure on the right side, and I move to the left, and again, work from the bottom of the groove up to the top. And if you look very carefully, I don't know if you can see it, but there's about 12 or 15 little red punctures there. The patient is then holding pressure on both sides while I get ready to do a lip procedure. The patient is then reclined slightly, and I'll march across the pink of the lip. I use my index finger to push the pink of the lip out. I start at the corner, I inject the pink of the lip and go from one side to the other, hold pressure, and then I go to the bottom and I inject one side and go from one side all the way to the other. Again, 12 to 15 punctures per lip, a total of 0.6 cc's per area. And at the termination of the procedure, I'm having the patient hold some firm pressure on her lips, because lips can swell a bit too. But afterwards, she survived, she smiled, she's happy. And if you look at her immediate after picture, this is how patients look immediately after a silicone treatment. You can see that her nasolabial folds are slightly improved. The lighting is a little bright over here, so you may not be able to appreciate the marionette grooves are filled in, and her lips are one size bigger. Clearly getting to her daughter's wedding in 2 weeks was not an issue.